Words of wisdom. No other body part is amputated, reconstruction, or burned without physical therapy intervention as the first line of treatment in the rehabilitation process except the breast. This was written by Nancy Roberge in June 2004 and really makes a good point, because if we think about other types of amputations, which really a mastectomy is an amputation, rehab is always recommended. So this is something that is really, really important to know, because rehab is not considered part of the normal chain of events after breast cancer surgery, and hopefully things will change. Phase 1, day 1 to 14 with drains in place. The most important thing about this time, usually you're not going to be seeing a patient during this time, but you might see them, is teaching them breathing techniques. Deep breathing is so, so important, because when somebody has pain or they're fearful, they're going to be holding their breath, and you want them to be able to relax. So teaching them deep breathing, which we learn in Pilates and which we're going to be going over later, can be really, really helpful. Exercise should be encouraged several times during the day within pain tolerance. It's better to perform exercises 2 or 3 times during the day, so that the goal here is to prevent frozen shoulders. Gravity limited shoulder flexion, extension, abduction, and adduction can be performed using a table and a ball, and you can do the traditional pendulums. If someone has no drains, then exercise can proceed more rapidly. Phase 1. Here are some general recommendations. Do not lift more than 5 pounds. Refrain from push-pull activities like vacuuming. Light housekeeping, such as dusting and light meal preparation, are okay. So we want you to be doing some functional activities. The arm should be elevated at night to decrease swelling with pillows, so the elbow above the heart. Functional activities such as washing your face and brushing teeth are primarily elbow, wrist, and hand actions, so they should be and can be done. Be sure to promote elbow flexion, extension, supination, pronation, and foam squeezes to reduce edema formation. You can use a magic circle for the elbow, and I'll be demonstrating that in a few minutes. Usually patients can begin range of motion to the shoulder once drains are removed. This can vary from doctor to doctor, from physician to physician. However, what seems to be more of the norm now is that 90 degrees flexion and abduction is usually what is permitted while the drains are in place. So basically this is everything that is within functional limits: washing the face, brushing the teeth, as I mentioned before. And we're going to bring Nancy back for this section. We're going to start with phase 1 exercises, which are basically exercises to get the patient familiar with the scapula. So Nancy here is going to demonstrate, and I would like Nancy to sit up straight. Okay, your chest should be open. Okay, we're going to work on scapula elevation and depression. So what I want Nancy to do, okay, get your head centered. Okay, I would like you to bring your shoulders up to your ears and inhale. So inhale, and now exhale as you bring them down. Okay, now make sure you sit up straight. Okay, inhale and exhale. Now try and bring both shoulders up equally. So inhale and now exhale. Last time, inhale and exhale. Okay, let's get a view from the back. So Nancy's going to do the same thing. Now make sure you're sitting up straight. Your chest is open. Okay, shoulders are down. Head is in neutral. Okay, so now you're going to inhale, shoulder blades come up, and now exhale, come down. Bring them up. Now this one isn't coming up as much. And now down. We want them to be equal. And now come down. Last time. Get that one up and down. Okay, good. Now we're going to work on protraction and retraction. So you're going to come and face this way.
Like this?
Okay, yeah.
Okay.
And you're going to bring your arms up to shoulder height. So remember, women facing in. Remember, phase 1, women have drains in their arms. They may have drains. They may be afraid of moving. So that's why we're working on the scapula here. And we want to ensure that the scapula, we don't get any frozen shoulders. So again, we want Nancy sitting up straight. The point here is that we want to get a neutral scapula. So now these are going to be shoulder width apart. Okay, you're not going to move the arms. What you're going to do is you're going to protract the arms forward, keeping the same width. Protract and now retract. Bring them back. Squeeze the shoulder blades together. Excellent. Keep the same width, sitting up straight. Okay. So now we're going to inhale as you protract. Protract. Don't bring your shoulder blades up. That's the hard part. And now, as you exhale, keep the shoulder blades down and retract. Remember, we're focusing on the middle traps here and lower traps. Keep the shoulder blades down. Inhale. And now, don't bring their shoulders up. And now exhale. Now I want you to find a neutral place in between. So where would be a neutral place? Bring your shoulder blades up. We don't want them too protracted and too retracted. So we want them down. And we want Nancy's chest nice and open. Okay. Very good. So that would be like a neutral position of the scapula.
When you mean chest open, what do you mean?
I mean your chest. I mean there's your shoulder
don't
blade.
Be rounded in.
Yes.
Okay.
Yes.
So you want the shoulders out. Don't round them in. Okay.
Yeah. Exactly. And you're sitting up tall, so you feel wideness across this area.